My name is David Fernandez, and I'm an attending rheumatologist at Hospital for Special Surgery. The main areas of clinical focus that I concentrate in are diseases called inflammatory myopathies or myositis. That's autoimmune diseases that affect muscle, where the white blood cells that normally defend us from things in the environment sort of mistakenly attack and injure muscle tissue, resulting in weakness. So we see patients of all ages. This is a rare condition, so it's not an overwhelming number. There's a slight predominance of female patients who are affected relative to male patients. And the disease is actually quite variable too. So everybody who is affected by the condition has their own course. And that's difficult for people to sort of wrap their heads around because it's a rare condition to begin with. They're frequently the only person that they know that has, been affected by it. It's the first time they've heard the word. And so it's important for me to give them that context so that they understand sort of how the disease, manifests, how it's likely to progress, what we can do about it. All of these conditions are chronic conditions, that they require long-term treatment, they require a lot of buy-in on behalf of the patient. So the patient has to commit to a course of treatment, and so, when they take the medicines, they have to take them, believe that they're going to work, and stick with the course, even if they have, some side effects. And so what I've found is that it's critical that they trust me, that they understand that we have the same goal, and that goal is that their symptoms be as well controlled as they possibly can be. And then once we establish that, finding what's the least amount of medicine that keeps them that way. When we were able to positively influence patients, it's tremendously rewarding. And I think that that's particularly the case in myositis,